And thanks so much for joining us. I'm Erica Heartquist, Public Information Officer with the Oregon Health Authority. Today, we are providing an update on the latest developments of the state's continued response to COVID-19 and providing information on hMPXV, which is the human monkeypox virus. Joining us today is Dr. Dean Sidelinger. He's the health officer and state epidemiologist. And this is a friendly reminder to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. I will be granting permission to record as well as Britt Parrott one by one. This is an opportunity, again, for members of the media to ask their questions and hear from our expert. The public is always encouraged to ask questions during our Facebook Live events. So let's get started. Dr. Sidelinger.
Thanks, Erica. There's a couple of requests in the chat just to make sure that they were granted, and then I'll get started.
I think we got them all. Thanks, Dean.
Okay. Good morning. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist at the Oregon Health Authority. Thank you for joining us for our July update on the state's continued response to COVID-19. Today, I'll be providing on the state's ongoing measures to safeguard the care for Oregonians, as well as an update on the state's ongoing efforts addressing the outbreak of hMPXV, or human monkeypox virus, which was first detected in Oregon only last month. Since OHA's last update on June 17th, daily reported case counts have leveled from a rolling 7-day average of 1,455 cases reported on June 17th to 1,400 reported on July 17th. This mirrors what the Centers for Disease Control and Prevention is recording nationally. In Oregon, test positivity rose slightly from 12.6% reported the week of June 17th to 13.9% reported the week of July 17th. However, we know our reported cases are not capturing the full picture because many people are taking at-home tests and not reporting results, and many others are not testing. Data in Oregon and the Pacific Northwest region, as well as data collected nationally, indicate there are high levels of transmission. On July 14th, the CDC reported that 21 counties in Oregon are in the CDC's high COVID-19 community level, indicating high levels of COVID-19 and increased stress on hospitals. For counties that have entered into this category, OHA and the Oregon Department of Education have encouraged schools to continue using layered mitigation strategies for education settings that are operating during the summer school season. I'd now like to highlight the latest developments on the Omicron subvariants BA.4 and in particular BA.5. Both are still spreading and are causing an increase in infection, including breakthrough cases among those already vaccinated. We are seeing this in Oregon, in other states, nationally, and in other countries. OHA also believes that BA.5 has gained predominance here in Oregon. One of our best tools to track COVID-19 transmission right now is the wastewater surveillance system that OHA implements in collaboration with Oregon State University in approximately 40 communities statewide. OHA monitors the spread of the virus through samples collected from sewage systems. Wastewater monitoring shows high levels of COVID-19 in our communities statewide. This month, in conjunction with the World Athletics Championship in Eugene, from July 15th to July 24th, OHA and OSU are working with Lane County Public Health and the University of Oregon to conduct daily sewage monitoring in Eugene for COVID-19 and other diseases. Now, I want to highlight hospitalization numbers. Since our last media event a little over a month ago, the number of hospitalized patients with COVID-19 in Oregon has risen, likely driven by infections linked to the predominance of BA.4 and now BA.5. Hospitals are stressed across the state due to patients with COVID-19 as well as other diseases, in conjunction with impacts on the workforce from COVID-19, as we are 2.5 years into our battle with this disease. Since our June 17th update, hospitalizations for COVID-19 have gradually climbed from 309 COVID-19 positive patients reported on June 17th to 424 reported today. The Oregon Health and Science University's modeling team, led by Dr. Peter Graven, published his last forecast on July 7th, that the number of COVID-19 positive patients in Oregon's hospitals would hit 479 patients on July 12th. This is still well below half the number of hospitalized patients with COVID-19 illness recording during the Delta and Omicron waves, when we had nearly 1,200 patients with COVID-19 in the hospital. We recognize the prolonged strains on our hospital systems and our healthcare workers have led to burnout and turnover in their staff. OHA continues to track COVID-19 hospitalizations and support our state systems. We remain in close communication with health systems to discuss state and local COVID-19 trends and the challenges facing our healthcare providers and healthcare personnel for caring for residents. We remain ready to respond to any future surges, keeping hospital beds available with enough hospital staff available to care for all of us ensures the system is ready when it's most needed for that patient needing urgent care from a car crash, cardiac event, or other life-threatening emergency. While we're projecting there is sufficient hospital capacity to care for everyone across the state, collective efforts taken by all of us will continue to blunt the spread of COVID-19, and they're important. This includes being up to date with recommended vaccinations, wearing masks in crowded indoor settings, and consider changing or postponing activities that promote spread while COVID-19 rates are high. This protects those we care about most and lowers community spread, keeping those critical hospital beds available when they are needed most. I also want to share good news, particularly about COVID-19 vaccines. The vaccines, which are widely available and free to all residents, remain remarkably effective based on the evidence at preventing severe disease and death. Let me repeat that. Even with the new variants, whether it was Delta, the initial Omicron variant, and now the Omicron subvariants BA4 or BA5, they're still providing significant protection against severe disease and even the likelihood of dying. This is what will keep most of us out of the hospital. Getting vaccinated and being up to date with your boosters remains our best tool. Just yesterday, the Centers for Disease Control and Prevention endorsed the FDA's authorization for a fourth vaccine. And last night, the Western States Scientific Safety Review Work Group also recommended the vaccine Novavax for use in Oregon, Washington, California, and Nevada. Novavax is a 2-dose vaccine that does not use mRNA technology like Moderna and Pfizer. It is also not a vector vaccine like the Johnson & Johnson product. Novavax's COVID-19 vaccine uses what's known as protein technology, where only parts of a virus are used to stimulate the human immune system. This has been used widely for decades and around the world in vaccines for shingles, hepatitis B, and the flu. Clinical trials in 2021 showed that a 2-dose series of the Novavax COVID-19 vaccine was over 90% effective at preventing any COVID-19 illness in all adults and 100% effective in preventing moderate or severe COVID-19 illness in adults. This data was collected before the circulation of the Omicron variant, and so it likely has changed given our current situation. The Novavax vaccine will not be immediately available, but should be arriving in Oregon and other states soon. And once supplies become available, Novavax will provide another safe way for you to protect yourself from COVID-19 if you're not yet vaccinated. I want to thank the nearly 7 in 10 Oregonians who have completed their vaccination series. For those who have not had a chance to get up to date with your vaccine, including boosters, it's still the best tool, particularly for those at highest risk of preventing COVID-19. You can find vaccines at clinics, pharmacies, and vaccine clinic sites in communities throughout the state. We want to remind our older residents and adults at high risk who do get COVID-19 that the highly effective treatment called Paxlovid is available as a pill. You can find more information about Paxlovid and other treatments on OHA's COVID-19 website. OHA strongly encourages anyone who may be at increased risk because of age and underlying health conditions to make a plan now on where they can get tested and receive treatment if they become ill. Residents who don't have a healthcare provider should contact their local health center or call 211. Now I want to shift to provide a quick update on Oregon's response to the outbreak of hMPXV, or human monkeypox virus. As of yesterday, Oregon has identified a total of 32 presumptive and confirmed cases of hMPXV in 4 counties: Lane, Multnomah, Washington, and Clackamas counties, all among men. There are more than 2,100 cases across 44 states in the United States and the District of Columbia, and more than 14,500 confirmed cases in 70 countries that are considered to be a part of the current global outbreak. OHA is working with local public health authorities, tribes, and community partners to share information about hMPXV, the outbreak, and infection prevention strategies with people who might be at increased risk of infection. OHA is also sharing information with clinicians about the outbreak, how to recognize and test for hMPXV illness, and how to prevent the spread. Many of the infections in the current outbreak are from skin-to-skin contact, typically during sexual activity. People who have multiple partners, particularly ones they don't know, who have been in areas with large numbers of cases, seem to be at higher risk. Many of the infections in the current outbreak have been among men who have sex with men. As such, OHA and its partners have been doing extensive outreach to the larger LGBTQIA+ and queer communities to share information on testing, prevention, and treatment strategies so that they can take steps to protect themselves from the virus. OHA is also helping promote the availability of hMPXV vaccines, which are used to protect people who have known exposure to someone ill with an MPXV infection. Vaccination actually works to prevent disease or decrease disease severity even after someone was exposed. At this time, OHA is working with our federal partners to secure additional doses of hMPXV, which have remained in short supply. As more vaccine becomes available, OHA will work with our local public health, travel, community, and healthcare partners to encourage vaccination among those most at risk and promote vaccination clinics for those most at risk. These are expected to begin this week and continue into the following week. As we head into the middle of summer, we hope you can enjoy the beauty that is found in abundance in our state, whether it's a park near your home, the coast, a favorite lake or river, or the mountains. Being outdoors with friends and family can be a great way to stay healthy. Along with being up to date with vaccinations, all of us can still wear well-fitting masks, particularly when we may be around others in indoor settings. For individuals at high risk or those who care or live with someone who's at high risk for complications from COVID-19, wearing a mask in indoor public places offers extra protection. And wearing a mask in areas of the state seeing higher transmission provides protection to those around you. And with that, I'll open it up to questions from reporters. Thank you.
Thank you, Dr. Sidelinger. And just a reminder to please use the raise your hand function. If you have a question, I'll add you to the queue and call on you to ask. Our first question comes from Lisa Balick with Coin TV. Lisa, go ahead.
Thank you. Dr. Sidelinger, hate to bring up back to school already, but it is almost around the corner, another 5 weeks or so for some school districts. At what point will there be a recommendation coming from OHA in terms of whether or not a district should go ahead and require masking? Again, it will obviously be on a local district by district basis, but what kind of guidance will there be coming in terms of case numbers or classroom numbers?
Thank you for that question. The current guidance that the Oregon Department of Education has released in conjunction with the Oregon Health Authority refers back to our Centers for Disease Control and Prevention guidelines around layered mitigation strategies in schools to prevent and reduce the spread of COVID-19 in schools. We have several measures in place. We've worked with schools to increase ventilation in settings. They have funds available to them, and many have done that either through systemic changes or with portable filtration systems. Vaccinations are required for staff and adults in these settings, and we encourage vaccination of students in these settings. Masks can still remain a critically important point, particularly for those most at risk for complications, whether they're students or staff. And ODE and OHA, in alignment with the Centers for Disease Control and Prevention, recommends implementing universal masking at a time when spread of COVID is high in communities. So when a community reaches that high level of spread, we send a letter to the superintendents in counties, as well as local public health officials, to remind them to go back and review guidance and implement as many layered mitigation strategies as possible. For now, with the current situation in Oregon, we're leaving the requirement for those masks in indoor school to local decisions, but we have material out there to support them in making that decision and talking about that as they do what's best for their own individual school community. I don't anticipate a return to school in the fall coming with a requirement at the statewide level, but there may be several school districts that continue their mask requirement that was implemented in recent weeks due to this current surge at least here in the Portland metro area. And so those schools will make their decisions about keeping those requirements into the fall.
Thank you for that question. Our next question comes from Tatiana with the Register Guard. Go ahead, Tatiana.
Thanks so much. I have a question about subvariant BA.5 as that starts to dominate nationwide. I'm wondering if you can outline some of the ways that officials think subvariant BA.5 might differ from previous variants and subvariants. I'm particularly curious about how communicable it might be, potential severity, associated hospitalizations, and of course, fatalities.
Thank you. As with the other Omicron subvariants, BA.5 appears to be extremely transmissible. And in fact, when BA.4 entered into Oregon and other states, that was a predominant, that started to gain traction before BA.5 entered. And now in Oregon, as in other states, BA.5 is outcompeting that, indicating that it has, potentially some advantage in the transmissibility realm. We know that some of the mutations seen with BA.5 help it to elude the immunization or elude individuals' ability to get off resistant vaccines, still appear to be holding steady, preventing hospitalization, including against BA.5. We don't yet have enough evidence to know that definitively whether BA.5 is causing more severe illness individuals to it compared to others. I've seen a slight in the percentage of folks hospitalized in the ICU, indicating that there may be something from BA.5. So it's important for people to continue to take steps for themselves, being up to date with vaccination, wearing masks in setting, something that we can do to fight off BA.5 and likely a variant comes out of COVID.
I'm going to interrupt. There seems to be a bandwidth issue, technology, right? Let's all reset for a quick second because we want to make sure we answer your question. And then because we've got several reporters left, I see you all and I've added you to the queue. So thank you so much. Give us 1 second and we'll figure out what's going on. Stand by.
Is that better on my end, Erica?
It still seems difficult to understand you. Yes.
Okay. So, if you give me 1 quick moment, I will reset and join.
Sounds good, everyone. Thank you for your patience. He'll hop off and hop back on. Perhaps because it's so highly attended, we've got a lot of people with questions. So please stand by and we'll be right back.
Erica, let me see if that works better. And if so, I will go back to my BA.5 answer.
It does. It seems to be working well. Thank you again for our media partners for your patience. And go ahead with your answer for the Register Guard. Thanks again.
Thank you for that question, Tatiana. We are still learning information about BA.5. What we see in our data is that BA.5 has become the predominant variant here in Oregon. It seems to have passed BA.4 as it has in other states. This indicates that the transmissibility of BA.5 is very high, and we've seen that across all Omicron subvariants. We know that some of the mutations in the BA.5 virus have allowed it to escape immunity, more so than some of the other BA.5 variants. Vaccines against people who are vaccinated with the vaccines, in particular those who are up to date, seem to still have great protection even against BA.5 for hospitalization and death, even though it may not be preventing all transmission. As for the severity of infections with BA.5, we don't have a significant amount of data to say definitively whether or not it causes more severe infection. We are monitoring the percentage of folks who are in the hospital with COVID-19 who wind up in the ICU, and that percentage seems to be trending up a little bit, indicating that there may be an increased severity with BA.5. But for this reason, the increased transmissibility, the potential for increased severity, and the vaccine breakthrough, it's important for everyone to look at their vaccine status, be up to date, as we know that still provides protection against hospitalizations and death, and then take other steps like wearing a mask in crowded indoor settings or other settings that promote the spread of COVID-19 at a time when COVID-19, particularly BA.5, is spreading so rapidly across the state.
Thank you for that question. Okay, we're going to go to our next inquiry. It's from OPB, Amelia. Go ahead, Amelia Templeton.
I have a couple of questions about human monkeypox. So I just want to clarify, you said so far all of the cases in Oregon have been in men?
That is correct.
Do you know what percentage have been cases in men who have sex with men?
I don't have the actual percentage, but many have been linked to behaviors where we think the transmission has occurred there. And we have also been working on some close contacts who live in households with individuals who have hMPXV, where we think that transmission happened due to that close contact.
Can you share if there are members of the LGBTQ community who are interested in accessing the vaccine or who have concerns, where can they go for information about whether or not they might be eligible for the vaccine?
Yeah, so right now vaccine is an extremely limited supply, but the manufacturer is bringing more into this country, and our federal partners are distributing it very quickly to states based on their burden of disease, as well as the population most at risk, looking at some proxies of individuals with HIV and individuals eligible for PrEP for HIV to identify those most at risk. OHA has a general web page around orthopox or MPXV virus, which updates the latest counts, who's most at risk, and will also link out to our local public health partners as vaccines become available. We know that in the Portland metro area, the Tri-County area has been especially hard hit during this initial outbreak. And so some additional vaccines have been allocated to Multnomah County to distribute to those most at risk. They did extensive outreach on the ground to areas where people might meet up and engage in behavior that could lead to the spread of MPXV, including bathhouses, certain bars that cater to gay and bisexual men, and other organizations that interact with men who may engage in these behaviors that are most at risk, and including going through some of their some clients and others with HIV who are known to engage in other risk factors that could put them at risk. They initiated a process of taking that limited allocation, doing screening questions with folks who called in, and those who were identified at risk were scheduled for appointments. And once those appointments ran out, they have a waiting list for when more vaccine is available. Lane County, which has additional cases, is working on setting up a similar approach with the highest risk population in their community. And as these clinics come on board, local public health will work to get outreach to those most at risk, and OHA will help in getting the word out if those communities need it. But they're still in fairly limited, vaccines are still in fairly limited supply, and those who we'd recommend for vaccine is actually fairly small. I want to assure most Oregonians that they are not at risk for getting an hMPXV infection. This is not spread nearly as easily as COVID-19. It does require skin-to-skin contact while someone is sick. So it is not spread from people without symptoms. It is not spread from a casual passing by with someone on the bus or on the sidewalk or in a shared airspace. We know that there could be some transmission for prolonged contact kind of face-to-face and droplets, but it appears to primarily be skin-to-skin transmission from those who are sick. So individuals who are developing symptoms consistent with MPXV, starting out with some initial fevers, muscle aches, tiredness, followed in days by a rash, often on the face, traveling to the limbs, maybe in the genital area, to contact a healthcare provider, let them know that they have symptoms that could be possibly MPXV and make arrangements to get tested. If you have any of these symptoms, not engaging in close physical contact, including sexual contact with other individuals, is the best way to keep others safe. And having a conversation with potential sexual partners about whether they're sick, symptoms they may be having before engaging in that activity is another way that people can keep themselves safe. Right now, it is that kind of close skin-to-skin contact that's promoting spread. And so we hope to be able to limit that by targeting those who are most at risk and engaging in these behaviors with post-exposure prophylaxis. So giving vaccine after exposure to these high-risk behaviors. And as vaccine supply becomes more abundant, to be able to move into a more preventive posture to provide that protection to individuals most at risk.
Okay, I just want to make sure I understood that last part clearly. So right now, based on the supply, you are not giving out the vaccine prophylactically to people who might just be at risk because of their sort of broader demographics. You are giving out the vaccine prophylactically to people who you know have engaged in specific high-risk behaviors that might have led to exposure. And then some of it is being given, I assume some of it is also being given to people as a treatment or to people who have active cases. Is that right?
I'll start with that last part first and then go over how we're prioritizing. For those who are sick, we do have effective antivirals that are available to take in oral form. Those are available from the Strategic National Stockpile, and we have some in Oregon and have treated several of our patients who are diagnosed with hMPXV. The vaccine right now is being used to prevent further transmission and decrease severity in individuals who may have been exposed but have not yet developed symptoms to decrease severity of their symptoms. So during an investigation interviews with an individual who has hMPXV infection, we will try and identify individuals who they had close physical contact with while they were sick to offer them the vaccine to prevent them from getting sick. But we are also now offering vaccine to individuals who may have engaged in risky behavior with multiple sexual partners, particularly anonymous sex partners that they may have met at a venue like a bathhouse or online, where they don't know the history or don't know how to contact that individual, but it's behaviors that put them at risk. They would be eligible currently to receive vaccine in these initial clinics. As vaccine is more prevalent, we would be able to expand that to individuals who are considering engaging in those sorts of activity, but have not had that recent contact to try and prevent the spread and blunt the spread of this disease even more. But we need to kind of keep pace with the vaccines we have. So right now we're targeting those individuals who've had those exposures or potential exposures so that we can prevent them from developing symptoms and prevent them from spreading disease to others.
Thank you for those questions and thank you for your responses, Dr. Sidelinger. Okay, our next inquiry comes from Joni Land with OPV. Go ahead, Joni.
Thank you so much. Going back to hospitalizations, we've heard that some hospitals in Oregon are currently dealing with major staffing shortages that are making this rise in hospitalizations very tough to handle, with even some comparing it to being as bad as it was during Delta and Omicron waves of the COVID-19 virus. I'm guessing, can you kind of speak to that and sort of what's behind that and maybe what the state is doing in response?
Thank you. Our hospital systems across the state are extremely stressed, and it's not spread evenly across the state. In Central Oregon, I think a hospital system is even more stressed than they are in the rest of the state, but no healthcare system is immune from this. So while the number of COVID-19 positive patients is well below where it was in recent surges, that is not the only thing contributing to the stress on hospitals. There are patients with other conditions, some with chronic conditions who may have delayed care or may have complications to their chronic conditions showing up for hospitalization. Summertime is a typical time when staffing levels go down in hospitals as people take vacations. Respiratory viruses typically aren't spreading. So this is often a time where hospital staffing is lower. And we are now 2.5 years into this pandemic. We estimate that right now, with the current infectiousness of BA.5, about 6% of Oregonians may be infected or recovering from COVID-19. And that includes our hospital staff who need to care for patients. So we have current illnesses that are keeping our hospital staff out of the hospital, out of other healthcare settings. We have 2.5 years of providing high quality, nonstop care for Oregonians with COVID-19, heart attacks, and motor vehicle crashes that's happened. We've had some people leave, the healthcare system because of burnout and other things. And so it's those hospital staffing stresses, both acutely because of infections, chronically because of burnout, COVID-19 and other illnesses that all have added up to create a crisis where our hospitals are extremely stressed. So we continue to have conversations with hospitals, try and identify supports where we can, work with them on options they have for staffing ratios and other things to provide continued quality care to the staff that show up, and working to try to identify ways that we can get patients discharged to lower levels of care when that's appropriate. But those same systems are also stressed by staffing shortages, and so it is kind of a domino effect. We will continue to have conversations to work and provide resources where we can to get patients the quality care they need. But I encourage all Oregonians to take a couple of simple steps to help at least cut down on their impact on the hospital system. Being up to date with vaccinations will help keep you out of the hospital. Wearing masks in crowded settings will help keep you out of the hospital, help keep you from getting COVID-19, keep you out of the hospital. And just reconsidering your plans during this time when COVID is spreading high, particularly if you're at risk for complications, will help keep you out of the hospital. And that's something we can all do to help lessen this impact. Because certainly, while our numbers are much lower than they were at Omicron and Delta peaks, hospitals are not feeling out of the woods. They are extremely stressed and doing everything they can to provide quality care for everyone across our state. But we all have a role to do in helping to support them.
Thank you for that question, and hopefully I pronounced your name correctly. Our next question comes from Lynn Terry with Oregon Capital Chronicle, and just a reminder to please raise your hand, so we only have a few questions left, so want to make sure we get to everyone. Go ahead, Lynn.
Yeah, I have two questions. One on the Novavax vaccine. Dean, do you think that's going to change the equation much? Because the vaccine, the percentage of people vaccinated has, reached a point, about 80%, and really hasn't budged much. And then I have a monkeypox question.
I think I'm excited to have Novavax as a fourth vaccine available for folks who want a choice. This vaccine uses a different technology, and in the earlier studies showed very similar effectiveness to the vaccines we're currently using. And in the real world where it continues to be used, we show that protection against severe disease will continue to help. So while it may not have a major impact because it's available for those who are not yet vaccinated, and that's a fairly small percentage of those in Oregon, there may be some folks who are still questioning their vaccine options between Johnson & Johnson, Pfizer, and Moderna, and wanted an additional option, and that this option is now available for them, or will be available in the coming days for them. So while it may not have a huge impact, right now it could help an individual who's been reluctant to get a vaccine, and that individual will have more protection, which is great. As we continue to learn more about this vaccine, it may become more widely available to younger groups or as boosters, and that will again provide additional tools we have to fight this virus.
My monkeypox question is, how sick are these 32 people getting? I mean, has anybody been hospitalized? Are they going through the whole course of symptoms and they're fine? What's the level of severity of symptoms?
Yeah, so while we're not seeing high levels of hospitalization, and we have not seen deaths from this current outbreak outside of areas where MPXV was endemic before this outbreak, that doesn't mean that folks are not sick. What we're hearing from patients here in Oregon, as well as other patients across the United States and as part of this outbreak, is many people are experiencing extreme pain because of these lesions. These may be lesions in their oral cavity that are causing them trouble with drinking, with eating. These may be lesions in their anus or rectal area that cause extreme amounts of pain that make it difficult for them to defecate and have really caused worse pain than they said they've ever felt in their lives. So pain control becomes a really important component for these individuals, assuring that they can stay hydrated and get enough to eat. Those are the types of symptoms we're seeing, but no life-threatening symptoms in individuals here in Oregon, and no fatalities across this current outbreak. But that doesn't mean it's without morbidity. Again, these people are reporting extreme pain, many of them, and a rash that is extremely uncomfortable and can last for several days to weeks. So, my heart definitely goes out to individuals who are experiencing these symptoms. And that's why we've been offering treatment for some individuals, particularly those who might be more at risk of complications, which may help lessen these symptoms, and why we are offering vaccine to those who are exposed or potentially exposed so that we can hopefully prevent symptoms or decrease their severity if they still do develop the disease.
Thank you for those questions. Our next question comes from Nick Morgan with the Mail Tribune. Go ahead, Nick.
Thank you. My question was just surrounding Novavax and its availability. It sounds like you mentioned it was in the coming days. I'm just wondering if you could kind of expand on the rollout for the new vaccine, and is this something that you expect in the next week, in the next month?
Thank you. While the Novavax is not yet here in Oregon, I would expect that to be arriving in the coming week or so. Once that is there, we will add it to our Get Vaccinated Oregon tracker so that individuals can try and find that. It will initially be available in limited supply. And again, it would be offered to individuals who are adults who are not yet vaccinated. So a fairly small population of folks who are eligible for this vaccine. But when it does arrive, we will be ready to distribute sites and get that information on our website, and that's a 2-on-1, so that individuals who are looking for a Novavax vaccine to get themselves protected against this infection will know where to go. I don't have a definitive date, but I hope it'll be here in the coming week or so.
Great,
Thank you
thank
for
you.
that question. Oh, do you have a follow-up, Nick? Go ahead.
No,
Great. Well, thanks so much. Our next question comes from Kevin McNamara with KTDL News 10 in Southern Oregon. Go ahead.
Yes, I'm down here. Yeah, as you said, Southern Oregon, Region 5 of the response, which only has one available ICU bed currently, based on like those current numbers, a little bit reminiscent of what we were seeing last year around this time with the worst of the Delta surge, where people were just getting treatment in some cases just in hallways or lobbies because they were so stressed. Are there any sort of plans in place from the state to try and head off these worst case scenarios again, if and when hospitalizations continue to rise?
Yeah, thank you. I'll start with, all of us have a role in helping to prevent COVID-19 and reduce impact on hospitals by being up to date with our vaccines and wearing a mask. We continue at OHA and our other partners at the state to work with our healthcare partners in a regional fashion to try and ensure that care is available for those who need them. So as hospitals fill and they look to other hospitals in a region for transfers, to transfers out of the region for a higher level of care, or when those hospitals are full, we continue to rely on that system and that amount of communication. Hospital beds, and particularly ICU beds, are extremely limited right now across Oregon. And that isn't because physically we don't have the hospital beds, the furniture, the room for people. It's the skilled staff, nurses, physicians, respiratory therapists, and all the others who need to care for those patients who are in limited supply because of direct impacts from COVID-19 right now, as well as burnout and exhaustion from these past 2.5 years. So we'll continue those conversations, try and identify ways to get patients out of the hospital who need a lower level of care, to assist with staffing for those hospitals who need it, as we have staffing contracts in place that can be accessed to bring additional staffing in. But we're competing with other states for the same level of staffing, and staff, even in those contracts, are also tired and hard to get. So we'll continue those conversations, continue to work on a regional and statewide approach to assure that even in a region that may have one hospital bed available, that we can assure people can get out of that region to get the hospital care they need. But certainly this is a very stressful time for our hospital systems. And, there are longer wait times, more time spent in the emergency departments than others. And many, providers wish they were providing a different type of care right now, 2.5 years into this. But this is where we are right now due to multiple factors.
Thank you for that question, Kevin. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thanks. I've got several questions. First, how many people are reported in ICU beds today?
I don't have that number right in front of me. I'll try and get that for you while we're talking.
Okay, appreciate it. And what precisely is OHA's current masking recommendation? Can you define that, please?
Yeah, so right now I would recommend that anyone who wants to wear a mask should wear a mask in indoor public settings and in outdoor crowded settings where they're close to other people. As far as specific recommendations, anyone who's at high risk for complications from COVID-19, older Oregonians, those who are immunocompromised, those with underlying conditions, lung disease, heart disease, obesity, diabetes that could put them at higher risk for COVID-19, or if you live with someone in those categories, wearing a mask regularly in indoor public settings will help protect yourself and protect the loved ones you return home to. In addition, I would say if your community is in a level that has reached the CDC's high community level, I would suggest everyone should be wearing a mask in indoor public places. The decisions about requiring masks in those settings are left up to local elected officials. But from a public health standpoint, wearing a mask regularly in indoor public settings in all those communities at the CDC's high community level and for populations who are at higher risk is a good idea right now while we're experiencing high levels of community spread across Oregon. And I'll have to follow up with you on the hospital piece. I was not able to look it up and talk at the same time.
So the recommendation doesn't extend then to areas with moderate risk?
I think even in those areas, wearing a mask offers additional levels of protection. So if you can't move an activity outside and you're going into a crowded indoor setting, you're going grocery shopping or other things, wearing a mask while you're in that setting will protect you. If everyone's wearing a mask, that cuts down on spread even more. So certainly in low and moderate levels, wearing a mask in those settings offers additional protection, but I think it's even more important in high levels, and it's extremely important for anyone at higher risk for complications or anyone who lives with someone who's in those higher levels, because they're the folks who are more likely to have complications, need to be hospitalized, and are adding to the strain on our healthcare system.
Thank you. And just real quick on the hospitalization. So right now the occupied beds is lower than the peak that was projected for last week. Do you expect that to change? Do you expect the hospitalization numbers start going up again or potentially exceed that projected peak?
Thanks. I think, we're expecting an updated forecast from Dr. Graven and OHSU this week. I think what we've seen in the data is that we reached, a high level, and while we've had some daily increases and decreases in those numbers, that they've remained fairly steady. I think what we'll likely see is a fairly, a current kind of plateau of COVID-19 positive patients in the hospital, likely over the coming days or week, before we see that coming down significantly. I want to emphasize again, though, that it's not just individuals with COVID-19 that are straining hospitals. It's individuals who are being cared for other conditions as well that are also straining hospitals. And our current number of COVID-19 hospitalized patients, as of the last weekly update, is 458 across the state, with 63 in ICU beds.
That was a week ago, so right?
That's the last update that I have from our weekly data, yes. But we've remained essentially steady from that last week.
Okay, last one. How many people have received the monkeypox vaccine in Oregon?
I don't have that number, so I'll have to follow up with you, Fedor.
Thank you so much.
You're welcome.
Thank you, Fedor. All right, speaking of follow-ups, we have a follow-up from Joni Land with OPB, and this appears to be our last question. So thank you very much. Go ahead, Joni.
Hi, just a follow-up from my previous question. You mentioned that the state and OHA has been talking with hospitals, trying to get them through this difficult period. Can you tell me some specific strategies that OHA is using to help them fix this overcrowding, staffing shortage issue that they're facing?
Thank you. I think one of the things we're doing is the communication out right now so that individuals know what they can do. Because again, all Oregonians do have a role in keeping themselves safe and healthy, particularly safe from COVID-19 by being up to date with their vaccines and wearing masks in settings that would promote the spread of COVID-19. We know that we have contracts for traveling nurses, as do many of our hospital system partners. Are prepared to work with them to help use our contract mechanisms if they don't have one to try and increase staffing capacity. But again, we're competing with other states and healthcare systems out of state for those same resources. Many hospitals are choosing to cut back on elective procedures when hospital beds are tight, and that's certainly happening across some healthcare systems right now. And so, we are communicating with them about those particular tools that they can use and that are accessible to them and work on individual basis on do they need to adjust staffing ratios or other things to continue to provide care for those who show up in their emergency room who need it for whatever reason they're there for.
And then one last thing, you mentioned earlier that this is not spread evenly across the state. Can you specifically name any hospital systems or that are particularly hit hard by this issue right now?
I think when we look at some of the areas that have less hospitals in them to begin with, so some of our rural areas across Southern Oregon and Central Oregon, are definitely spread tight. The St. Charles Health System in Bend has definitely been working through many staffing challenges and strains on their system, and OHA continues to have conversations with them about things that we can do together that they can do on their own to help with those strains. Those conversations happen. Like I said, yeah, Central Oregon, Southern Oregon are particularly hard hit, but no area of the state is spared from having hospital system capacity strains right now. We know that our neighbors to the north in Washington, the hospitals are also experiencing a similar issue. So this is not a unique to Oregon problem.
Thank you.
Thank you for those questions and your responses, Dr. Sidelinger. Okay, our very last question actually comes from OPB. It's a follow-up with Amelia Templeton. Go ahead, Amelia.
Yeah, I'm wondering, those 32 monkeypox cases, what's your estimate of if that is the real extent of the epidemic here in Oregon, or to what extent that's an undercount?
Thank you, Amelia. I think I can definitively say that's an undercount. With our initial case that came to Oregon, we had a very good source for where that infection came from associated with travel out of state. But as we identified additional cases, we don't always have that definitive link to where someone could have gotten it, indicating that there's community spread. So what we are currently doing is getting the word out about the types of activities that people engage in, which communities are most at risk, so that people know that risk and can take steps to protect themselves. We continue to communicate with our healthcare providers about thinking about MPXV infection in individuals who present with symptoms that could be consistent with MPXV. While many people have seen this rash in photos on the news or from the CDC website, and it is very impressive and it can be very impressive, some of the rashes that patients are presenting with are much more subtle. So we encourage individuals to think about this diagnosis, to collect the specimen, contact public health if they have questions about getting that specimen tested. Our state public health laboratory can do the testing, as can other commercial labs. It is readily available, but we need providers to think about it and order it for the patient in front of them. But yes, that 32 number is definitely an undercount of what's happening here in Oregon. And so we're continuing to get the word out about recognizing symptoms early, limiting contact with others, and then seeking vaccination if you're at highest risk. And hopefully those vaccines will continue to become more available over the coming weeks as additional vaccines from the Strategic National Stockpile are available to not just Oregon, but other states as well, because we're all in the same boat with less vaccine than we'd like to combat this problem head on. with that, I'd just like to say, thank you for the continued assistance in getting the word out. 2.5 years into the COVID-19 pandemic, we are all fatigued and don't want to hear about it anymore. But unfortunately, we still have Oregonians who are sick with COVID-19, recovering, caring for a loved one, or who recently lost someone to COVID-19. The steps that we all take, being up to date with vaccines, talking to your child's healthcare provider about getting them vaccinated, wearing masks in crowded indoor places, going outside and enjoying the Oregon summer when we can, and maybe changing activities around during times of high COVID spread are things that we can all do to protect ourselves, protect our fellow Oregonians, protect our healthcare system as we get through this extremely challenging time. With MPXV infection, it's another kind of story that people don't want to hear about. This is a very different infection, spread via very different types of contact. Right now, in certain kind of smaller groups and associated with certain behaviors, such as close skin-to-skin contact among men who have sex with men, particularly during sexual activity. So we are targeting our approaches at those most at risk, getting our limited resources out to those who could most benefit, and expanding those circles out as more vaccines become available. But it's not something that most people in Oregon who are not engaged in close skin-to-skin contact with individuals who are sick, individuals who they don't know who are strangers, or other things that are at risk. So this is not something to add to your worry list if you're not engaged in those behaviors, and that our public health colleagues, continue through the fatigue and exhaustion that I think we're all facing to support communities most at risk, get out information to some often marginalized populations, and work with our healthcare providers to support them in any way they can to provide the highest quality of care for their patients. So thank you all for your continued support in getting the word out. Thank you all who are continuing to take steps